Good morning, everyone. If you could find your seats, we're going to get started. I have the extreme pleasure of we're hosting one of my great mentors today, Dr. Fernandez, who is a palliative care physician and geriatrician here at Sinai. She completed her fellowship in geriatrics, where she also served as a chief fellow at the Icahn School of Medicine at Mount Sinai. As vice chair of education, Dr. Fernandez leads the largest geriatrics and palliative care training programs in the country, which trains about 20% of the workforce and has served as a mentor to many students, residents, fellows, and faculty. In 2011, she co-created the first integrated geriatrics and palliative care fellowship, which has now been disseminated to 14 other institutions. In 2019, Dr. Fernandez co-created the first national leadership and life skills course for integrated geriatrics and palliative care medicine fellows. And in 2020, Dr. Fernandez was the creator of one of the first combined medicine geriatrics residency fellowship programs in the country. And then in 2023, Dr. Fernandez became the principal investigator for the Brookdale Foundation grant to further advance leadership training in geriatrics and palliative medicine and transform healthcare for older adults and those living with serious and chronic illnesses. All that to say, Dr. Fernandez is a force in geriatrics and palliative care and one of our great leaders, and we're really honored to have her today for Grand Rounds this morning. Please join me in welcoming her.
All right. Every time I stand here, I'm way too short and I'm only getting shorter. So, oh well. Thank you, Shalene, for that introduction. Really happy to be with you here and also over Zoom. So I'm going to talk to you all about thinking about building future leaders. This has been really kind of the life work and a lot of work what I've done in the last 6 years I want to share with you. I'm going to disclose that we have been funded for this work through the Samuels Foundation, through the Macy Foundation, and through the Brookdale Foundation, all educational grants to further this work. I have to thank a lot of people. I want to thank them at the front end so I don't forget. And so my three other course directors that helped me develop this back when we were meeting together in 2018, two executive coaches, and then another faculty member who's a professor at UCSF, Lynn Flint. And a lot of our faculty are teaching within our leadership course, and our research assistants. And I'm going to share some of the data of what we found. And in particular, Ayla Peleg, Caitlin Kawada, and Deb Afasoli, who you guys know as some of the hospitalists within Mount Sinai. And lastly, I want to thank our current fellows and former fellows, my department, and Dr. Morrison, who's here, who's our chair, who's been very supportive of this work. So what I'm going to talk to you about is the why this is important, the what I'm talking about in terms of domains of leadership, and then the how, the strategies we've been using in terms of trying to integrate leadership training in postgraduate education. So I don't think I have to remind you all, but we are in an aging society. This is always part of a talk that we give, right? And we look at kind of the population back in the 1900s, where very few people were in that greater than 65. And as we see kind of going into 2030 and 2050, we're really having the squaring of the population, where we're seeing more and more of the population shifting to being older adults. Right now, 20%, in other parts of the world, 25% to 30%. So this is rapidly increasing, and we'll have more people over the age of 65 than younger people. So there's a lot of need out there. So how do we fill the need with a growing population, increased complexity, a lot of multimorbidity, a shortage of us who are specialists in complex disease? Healthcare is expensive. The payment models are moving to value-based care. And we need to be able to, as healthcare professionals, be able to lead these programs. And there's a lack of training and leadership training within our residencies, within our fellowships, within our medical school training as well. I'll talk a little bit about that as well, even though I'm focusing on postgraduate education. Really, the next steps of really pushing that down the pipeline and starting a lot earlier. And we're the best position. the folks in this room, the folks on Zoom, um, and everywhere that really does this work is really positioned to really improve care for those with serious illness and those who are older. You know, the concentration of risk is really in a small subset of the population, and evidence that both geriatric and palliative medicine improve value. And there are few strategies that can do both, improve quality and reduce spending. And really, you know, our purpose is to improve care. Um, there's not only the population need, right? There's also, it's embedded within our milestones. So every single one of our domains, if you look at the actual language in the domains of milestones, have leadership topics built in. So as a former program director, I'd always be like, where am I going to teach this? Do I have any space? Do I have any time? And how do we can achieve to that level 4 and level 5 and push our curriculum? So it's embedded in all patient care, system-based practice, professionalism, practice-based learning, improvement, interprofessional communication needs. So what we did was a needs assessment to really look. We were in our 35th year as a fellowship, as was said by Shalene in the start of my introduction, and we were training 20% of the workforce in the country. We did a quantitative evaluation of our graduates and realized that about 60% are in leadership roles within the first year of graduating fellowship, and 100% in 6 years. That's huge. That's exponential and really quick. That usually doesn't happen. So we started doing a deeper dive into, you know, how can we better prepare our fellows? Because the fellows that had graduated our program and really an outstanding program were telling us that a lot of the leadership training they were actually doing post fellowship. And so we started looking at doing not only that quantitative, but a qualitative needs assessment. We also, besides speaking to former fellows that were leaders, we also spoke to national leaders, experts, both private, public, VA, payers, society presidents as well, and asked them kind of what are some of those leadership topics we should embed within the fellowship? And then we used a modified snowball method where we asked leaders to suggest other folks to also be able to give us some feedback in terms of leadership. Dr. Pellig, as a fellow, took the lead on doing the study. What we did is as I said, we did some quantitative, we did semi-structured, we evaluated for thematic trends as well. And we developed really the constructs of the basis of our fellowship training in leadership. And what we found were certain domains that were really important: communication and management, mentorship and negotiation, apprenticeship, program development. And a big one is actually healthcare literacy. We were doing really well in terms of literacy around hospice and palliative medicine, but not so much about health systems. And we really needed to focus, and also to focus on self skills in terms of leadership. And so this was the foundation, part 1 of our needs assessment. Another part of our needs assessment is that we actually had a summit at ABIM. We had been starting the competency-based medical education pilot in the integrated geriatric palliative medicine. And we were rolling out to 14 institutions, and we asked the leaders, the program directors, and the fellows of the program, you know, what do you need in terms of leadership training? What specific areas should we focus on? And on this slide, we had a great response rate from the program directors as well as from the fellows themselves. And they really focused on educational and research. They wanted more on learner evaluation and feedback, more on mentorship, how do you communicate your vision, and navigating careers. What were the barriers that the program directors identified? It was time, it was expertise in being able to teach in these areas, and there was a crowded curriculum. Where do we fit it? We did an updated needs assessment, which we just published earlier this year, where we asked the hospice and palliative medicine program directors throughout the country. And I'll talk more about this because it's how we kind of amplified this curriculum later. And what you can see here, we had a response rate around 30% of program directors nationally. And the areas that they felt that they needed more training, that their fellows needed more training in, is managing conflict, giving and receiving feedback, emotional intelligence, team communication, resilience, mentorship, and coaching. But every area is more than 50%. What were some of the barriers? There were no guidelines around this area. There's not enough time, not enough faculty, and not enough funding in order to do this. So we were realizing there was a big need both internally and externally. So in 2019, before the pandemic, we started this endeavor. We actually rolled out, based on all this needs assessment and the 4 course directors, we rolled out an in-person leadership conference that was over 4 days here in New York. We got 10 institutions to send fellows, this was a jumpstart to a longitudinal curriculum that would start from September to June. And we were doing Zoom before Zoom was a thing, because we would meet monthly on these Zooms across all time zones in the continental United States, from California all the way to New York City. And we were meeting, and I'll talk a little bit more specifically about the curriculum, but every month. As you can imagine, March happened, 2020, and we had to learn, how do you pivot? We had to take a little bit of a break, right? Because we were kind of busy here in New York City. But we came back because the fellows wanted us to come back. They actually took this as an opportunity to check in, to talk about really the conflicts they were having, the struggles ethically that we're having, and a lot about resilience. And so we restarted actually in May of that year. So we took a break for March and for April and came back, and really learned a lot in terms of informing our future steps in terms of the curriculum. So we now have this curriculum that's really been going on since 2019, and I'll talk about how many fellows we've trained. But one big part of it is we have a learning platform that we utilize in order to communicate with all of our fellows. We have fire chats, community, we give all the materials of what we talk about when we meet once a month from September to June. We have annotated slides. We have breakout sessions and case studies, and we have resources, readings, and videos. And this is a method of communicating before the actual webinars that we have together. Most of them are very small group based, 2 faculty, 3 fellows. And I'll tell you more. We have 10 faculty that help facilitate and we have up to 20 fellows that we train every year. We do a baseline leadership assessment. We use the Agile DISC, but it's enhanced. We have an emotional intelligence component, and we have a platform called the Catalyst platform, where the fellows can share with each other if they want their profiles. And it's been very interesting to learn. One, we did it as faculty in the leadership team as well, of how we kind of, what are things we lean into? What are things that we can work with? How can it help facilitate our communication and even our programmatic development? So that's really informative. So we do that at the baseline in September before we launch every year. So we run this curriculum from September to June, meeting once a month. We have mini lectures that are embedded with a new, either 1 or 2 different tools. We have large group discussion, and then we have small breakouts. And like I said, the material and all the reading material are placed on that platform. The other enhancement of this intense course is we have coaching. We offer at least 3 coaching sessions within this 10-month period. When we started, I would say in 2019, Our two executive coaches, who are coaches for over 15 years, who have been certified by Hudson and IOC, the Institute of Coaching, they would do all the coaching. And what we were realizing with the fellows is that coaching had to be different. It wasn't like the typical executive coaching where it's like, just explore, find yourself. The fellows needed a more pointed and explicit coaching. And it was about leadership skills that they're learning within the program and how to apply it during fellowship and beyond. And so therefore we had to change the model a little bit of the typical coaching model and really have it a little bit more organic. And so we have fellows that take advantage of this, at least 3, and some fellows as many as 10 times. What's the actual curriculum and how do we frame it? And so we took an evidence-based approach of what are the best strategies in teaching areas of leadership and self skills, because we wanted the fellows to be inspired, empowered, have vision, and really promote change. And these are the foundations: communication, um, how to have commitment to your patients and caregivers and align yourself with them. How do you be a collaborator with other team? How are you a leader with different models of care? How are you an advocate and work better together? And how do you become an expert of complex care systems of care? So these are the foundations of what we formed our curriculum. To date, the number of fellows that we've trained are over 120 over these 6 years. So we train from as little as 14 to as many as 19 or 20 each year in this leadership program. The program directors commit to having the fellows be available at this time. We meet in one time zone, which is on a Thursday evening once a month, to be able to scope all the time zones. And I'll tell you a little bit more about the programs that we recruited. So these are the programs. We have programs, several in California, UCLA, UCSF, middle of the country, Indiana, Michigan, San Antonio, and several here on the Northeast and Southeast as well. Yale, Duke, a lot of the big programs from New York City, NYU, Sinai, obviously, Cornell. What's interesting is that this started as a venture first for integrated fellows, both in geriatric palliative medicine, but now we've been asked by other fellowship programs to actually participate. We looked now at the 5-year impact of this program and did semi-qualitative interviews with the fellows that have graduated. And we had a 75% response rate. Short term, all these fellows were involved in clinical work. Long term, they were interested in being involved in more leadership roles. And it could be in any leadership role, education, administrative, health policy work. So it's very interesting. And the bigger, really, and this we just published earlier this year, was really the qualitative comments. So we asked the fellows kind of what are the aspects that helped in terms of the core skills. Well, it enhanced their team productivity, self-awareness, colleague recognition, collaborative environment, and leadership alignment. They were understanding better what their actual strengths were. They were appreciating diversity in the work style, and they were learning how to foster supportive and inclusive, as well as tailoring the leadership. And we do these qualitative interviews 6 months to a year. So we're talking not immediate. We have the immediate, which is the quantitative, but we look forward to how they're actually applying this in their job. The other themes we had, what was the value of the course? It allowed them space for reflection, to do some perspective taking, to have clarity, enhance their understanding of how they can become better at decision making, and then how to lead to better choices based on evaluation. How did the actual skills help in this course help around leadership? they helped in terms of allowing them to do community building, collaboration, and innovation, as well as to recognize they had shared interest. Um, One of the things that this course has done is formed a community amongst, we have a large fellowship here, right? We have 33 fellows. Most of the country has 1 to 4 fellows. So this allowed the fellows to have a larger community sense in other parts of the country. The other value was around coaching. And most fellows had at least 3 coaching sessions. We had about 20% that actually had 8. So they fully took advantage of the opportunity for coaching. They appreciated the structured feedback, the reflection, and the opportunity to have open communication. They learned about transparent dialogue as well, and they did deep contemplation of what were the areas of growth. So big takeaways kind of with this 5-year look back at our evaluation of the current status of this intensive leadership course is that we enhanced emotional intelligence and confidence, we strengthened mindfulness and resilience, and we fostered community connection and leadership growth. But the story doesn't end there. We also developed a train the trainer model. We recruited over from 2020 to 2025. We started with only 4 course directors. So we ran that from 2019 to 2020. And then starting in 2020, we recruited more. So we've recruited 22 faculty. 6 of the faculty had actually taken the course. And all the faculty have a training within the course to be able to facilitate the information and also learn about coaching. Each year, I say this is like a meta QI project because we're enhancing the curriculum, updating the materials, updating our faculty guides, our cases to really serve what is happening in the clinical world and what the fellows need in terms of their leadership skills. So how about like measuring the impact in terms of the faculty's comfort in teaching leadership topics? Many had discomfort in many of these areas. Some were a little bit better, right, around communication skills, but some in terms of leadership styles, terms of negotiation, feedback. Pre-course, they weren't as comfortable, and post-course, they became more comfortable in these leadership topics. They became more comfortable in teaching these leadership topics as well, which we were really happy. And now what we try to do is recruit 2 to 3 new faculty each year, but have a main core of 8 faculty. So this curriculum, again, does not stop here because it continues. So one of the biggest things was how do you disseminate what we've learned to a broader audience? And we partnered with the American Geriatric Society and the Advancing Academic Program and Geriatrics Program and developed a basic leadership and life skills curriculum that could be self-paced. This is given as part of membership to the organization, and it's a basic course based on what we learned and gave in our curriculum. It doesn't have the coaching component to it, and we give this curriculum from September to July every year. These are the topics, many that were those foundations that I first showed you, from finding your best self to team and group building. And each module has some case studies and some reflections and some topics. It's a very self-guided educational model. There are 4 virtual webinars that are taught by our own faculty here. And we're having one this Friday, where we review some of this, but really do an interactive small group teaching. And then part of this curriculum is that we ask, it's a certificate, you have to complete all the modules, you have to attend 3 of the 4 webinars, and you do a case study where you used one of the leadership topics within a clinical case in your environment and do fellowship and do reflection. We offer an exclusive online community where the fellows are allowed with the facilitators to share some of their experiences on leadership. How many have we trained through this program? 375. So this has been exciting. So what I can tell you is how many fellows are trained a year just across the country in geriatrics? There are 170. We have up to 82. So we have a little bit under 50%, and this doesn't even count the fellows we train in the 20 that we train here. So this is a way to try to disseminate and give this curriculum more. I truly believe that leadership training shouldn't just be contained within fellowship, within residency. We have to reach further. We have to go to medical school, interprofessional education, and really kind of focus also on early career professionals. When we did the needs assessment, we also looked around at different programs. All programs are attached to either your early career, mid-career, or late career. There was nothing really focused on medical school residency. If you're a chief resident, you have Aptum. But otherwise, there's really no curriculum. So as part of the Ascend new curriculum, medical school curriculum, we actually integrated a thread, which incorporates the thread of leadership and professional identity formation. And this really focuses on teaching fellows how to assume leadership and professional roles and threads, communication skills, teamwork, interprofessional education and counseling. Laurel Hansen, who's one of the Jerry Palcare hospitalists here, is leading. We just did selectives this past year where we worked with first-year medical students to do a leadership assessment. We talked about team performance. We did sessions on crucial conversation, emotional intelligence, and talked about saboteur and sage powers. And they're welcoming us back, so that's a good sign in terms of really finding ways to continue disseminate. It doesn't stop there. I keep on going in terms of thinking about how can we reach more people. So this is super exciting piece that is just launched. This is free to all of you. You can go to that QR code and scan it. And this is a curriculum that is based from our experience in the last 5 years and builds on those other aspects of the domain when we did the needs assessment. So there are 18 courses. There are 3 units of 6 courses each. You can pick and choose what you want to do. There's one thread, which is the leadership and life skills, which is the foundation of a lot of the work we've done. The second is on US Healthcare 101, developed by Dr. Diane Meyer, who's the leader in this field and health policy. And then the third track is on business and organizational leadership skills. So how do you take all of that you learned in the first 2 tracks and then apply it into complex healthcare? And so these are self-based. This is enhanced from what we did with AGS and Actum because it has a lot more interactions. It has more cases, more videos. And because CAPC is part of Mount Sinai, and you all are employed at Mount Sinai, you get the opportunity to take this. By the end of the year, this course, right now it's rolled out, focused on residents and fellows, but it's going to roll out to everyone because we're going to have CME credits that are also embedded. So faculty and other healthcare professional, nurses, social workers can take these courses. And just to give you a flavor of what it is, there's leadership training, this one track around strategic planning, and there's 6 courses in there. There's the health policy, and then the business and organizational. So you'll land on this. You just need your email, and then you're able to register. And these are some samples, right? So one around healthcare leadership, around career success. There's some self-reflection, giving you some evidence base, and then you kind of interact. This is done through Articulate, so it's really well done. We have some prompt questions. How do you prioritize your work? How do you align your work? How do you build relationships? We look at the evidence, right? So really the top, when you look at the evidence, what makes a good leader? is being able to communicate and that emotional intelligence. Last is really, and this is ranking by other leaders and by patients and caregivers, is really your expertise and your knowledge. So the things that really count for being an effective leader is around emotional intelligence and communication. All right, we got some good noise kind of happening. Um, the the other module is around understanding as best as we can the healthcare system. How is Medicare, Medicaid? What does it fund? What are our what are our patients? What are the gaps, right, in some of that funding? So you go through kind of the 101 around health policy and healthcare. We actually look at per capita spending, and you go through this process of learning a little bit more about that. What after those two tracks, there is the actually being strategic and applying these skill knowledge to actual cases. And so then there's 6 courses that really deal into application, complex case management, co-management, hospital at home, palliative care at home as some of those case examples. How do you build out? How do you do programmatic development? How do you look at outcomes, right? How do you get meaningful in endorsement of these programs, right? And so you go through these case modules that really take you through that. How do you build relationships in order to have these models really amplify? So, what I want to say is, I really think leadership is required in training. I think that we don't do enough. We're trying to fill that gap. And I also don't think it should be confined to titles. I strongly believe that because I feel that that's sometimes the barrier of folks getting more leadership training. Um, and we have to start sooner. We can't wait until somebody gets there, right? Like we wouldn't wait for somebody to be an attending, right? In cardiology and GI, we give them skill sets beforehand. So we should do with leadership training. Um, Leadership and life skills can be effective, it can be empowering. It should be taught to other disciplines. And I really feel that this has to be accessible, it's key, and disseminated. And that's why we've been working to disseminate this to more. What have I personally learned through this journey is that really leadership focuses on being very value-based and human-centered. And this is a concept developed by Susan David, who founded the Institute of Coaching. And that foundational to any leadership skills is not, I mean, it's critical to know how to do the balance sheet. It's critical to know where flow of funds come through, but foundational is really how we are as human beings and why we came into these fields, right? And so thinking about how are we present in the work that we do, how do we learn more about our emotional intelligence, because it's something you can learn. How do we approach this with a growth mindset? These are areas of lifelong learning. It just doesn't happen and finish in our training. It keeps on going. How do we build in terms of our grit, our optimism? How do we work with each other? We spend a lot of time in communication training of how to more effectively talk to our patients and our caregivers. Have we spent enough time how to talk to each other? How to work in teams? And I think that is an area that we have to continue building, using those skills and applying. And then developing our own awareness and embracing is really critical. The why, this is a picture of my dad. My dad, this was him in medical school in the 1950s. He's a community-based non-interventional cardiologist who came to this country 60 years ago and taught me a lot. He retired when he was 89, right at the week of the pandemic when, because he said, Helen, I'm going to get sick. I don't have the equipment, so it's not a good idea to continue practicing. He taught me a lot about resilience. He taught me a lot about being a leader within his community. And he continued even after when he became frailer in his 90s, and he just died 3 months ago. And he interacted with a lot of different components of care throughout the last few years of his journey. And And it motivates me for the patients I serve, for the fellows, for the residents, for the medical school students we're teaching, and the interprofessional students, that we have to be better and learn how to be better as leaders. And at his bedside, he had this book he was reading, which is Leadership in Turbulent Times. I think it's really fitting. And so I think I continued learning a lot. He was a lifelong learner. He taught me how to continue learning in every aspect of my life and continue pursuing. Um, and so with that, I'm happy to take any questions, and thank you for listening to me.
Thank you for a wonderful talk and really inspirational. Nick, question.
First of all, thank you. It's good to have you here. I think it's clear based on your talk that like you've made the case for why leadership training matters and why we should carve out time for it. I think one of the things that's going through my head is like in a very busy residency program where like it's our time is already stretched in so many different ways. Like, how do we carve out that time?
Yeah, I mean, I think about, we carved this out in medical school curriculum. We had we take out some things, right? And everything is valuable and we sense that it's very valuable, but sometimes maybe we concentrate a little bit too much on certain things and don't give space. I will say, for the intensive course, that is because we're scoping so many time zones, it is after hours. And it requires a commitment to be able to attend 80% of those. And it was a commitment from the program directors to allow the fellows in other time zones where it might be earlier in the day during clinical work to have space for that, right? So it does require leadership commitment to allow you the time as a trainee to be able to participate. Because I think most of the time people are just kind of seeking these things out by themselves. I think there is opportunity within curriculum. You have to just carefully look at redundancies. Are there ways to be a lot more creative with curriculum? Is there flipped classroom, right? That's the reason we created the asynchronous. One, we wanted to disseminate it and be accessible and be off the shelf, but also you could take it, you know, in between things, right? You didn't have to be within a classroom setting to necessarily do it. But I do think it's a buy-in from the top that you're going to create space and time for this.
No, I agree with that. From like the HEMONC, like I'm thinking because on a national basis, there is from like ASCO, our for Oncology Association, there's leadership training programs, but it's really geared once you're a faculty member, there isn't anything kind of embedded in the fellowship like for geriatrics. And then trying to think about how to embed that into your academic half day, which is already, very limited. And you also have all these other curricula that are also embedded. So I think it's a very careful balance. Well, if there are no further questions, thank you, Dr. Fernandez.
Thank you.